Selegiline Hcl is a medication used to treat movement disorders caused by Parkinson's disease. It does not cure Parkinson's disease, but it may improve shakiness, muscle stiffness, loss of normal movement, and sudden switching between normal movement and stiffness. It may also improve your range of motion and ability to walk, dress, and exercise. Selegiline is usually used in combination with other medicines such as levodopa and carbidopa. It works by slowing the breakdown of certain natural substances in the brain, such as dopamine, norepinephrine, and serotonin. It is important to take this medication as directed by your doctor. The usual recommended dosage is once or twice a day, and it is best to take it in the morning to avoid any sleep disturbances. Be sure to follow your doctor's instructions carefully for the best results. When taking Selegiline Hcl, it's important to follow your doctor's instructions. Typically, it is taken twice daily with breakfast and lunch to avoid trouble sleeping. The dosage will be determined by your medical condition and response to treatment. It's crucial not to increase the dose or take it more often than directed. After a few days of taking Selegiline, your doctor may advise you to lower your levodopa dose. It's essential to follow their instructions closely and not to stop or change the dose of any of your medications without consulting them first. It may take a few weeks to notice the full benefits of the drug, so it's important not to stop taking it without consulting your doctor. If the medication stops working well or if your condition worsens, be sure to talk with your doctor about it. Some common side effects of Selegiline Hcl may include dizziness, abdominal pain, dry mouth, nausea, stomach upset, trouble sleeping, and headache. If any of these effects persist or worsen, be sure to consult your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. If you are taking levodopa along with Selegiline, you may experience more side effects from the levodopa. Make sure to inform your doctor right away if you experience any of these side effects: nausea, shakiness, muscle stiffness, or mental/mood changes such as hallucinations or abnormal dreams. Your doctor may need to adjust your medication or dose. It is important not to stop or change the dose of your levodopa without consulting your doctor first. Remember, the benefits of this medication have been prescribed to you because your doctor has determined that they outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. It's important to note that some people taking Selegiline have experienced sudden sleepiness during their usual daily activities, such as driving or talking on the phone. If you experience increased sleepiness or fall asleep during the day, it is important to avoid driving or participating in other potentially dangerous activities until you have discussed this effect with your doctor. Your risk of experiencing this sleep effect is increased by using alcohol or other medications that can make you drowsy. There are also some more serious side effects that you should report to your doctor right away, including fainting, loss of balance, mental/mood changes, unusual strong urges, changes in sexual ability/interest, increased shaking, tremor, swollen ankles/legs, difficulty urinating, unusual weight gain, easy bleeding/bruising, black/tarry stools, and vomit that looks like coffee grounds. Additionally, Selegiline may rarely cause extremely high blood pressure, hypertensive crisis, which can be fatal. Be sure to get medical help right away if you experience frequent/severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweating/clammy skin, widened pupils, vision changes, or sudden sensitivity to light. This medication may also increase serotonin and rarely cause a very serious condition called serotonin syndrome. If you develop symptoms such as hallucinations, unusual restlessness, loss of coordination, fast heartbeat, severe dizziness, unexplained fever, severe nausea/vomiting/diarrhea, or twitching muscle, seek medical help right away. It's important to note that a serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, it's important to consult your doctor for medical advice. Before taking Selegiline, it's important to let your doctor know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions. Be sure to talk to your pharmacist for more details. Before using Selegiline, make sure to inform your doctor about your medical history, especially if you have a certain type of adrenal gland tumor, cerebrovascular disease, heart problems, bleeding problems, history of severe/frequent headaches, peptic ulcer, diabetes, personal/family history of mental/mood disorders, personal/family history of high blood pressure, liver disease, or overactive thyroid. This medication may cause dizziness or drowsiness. Avoid alcohol or marijuana, as they can make these effects worse. It's important to refrain from driving or using machinery until you can do so safely. Limit your alcohol intake and talk to your doctor if you are using marijuana. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. You may need to stop taking Selegiline before surgery, so be sure to follow your doctor's instructions carefully. If you are pregnant, Selegiline should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if Selegiline passes into breast milk. Due to the potential risk to the infant, it is not recommended to breastfeed while using this drug and for 7 days after the last dose. It's essential to consult your doctor before breastfeeding. Selegiline HCl may interact with other medications, changing how they work or increasing the risk of serious side effects. This is not a complete list of all possible drug interactions. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Selegiline include antidepressants, other MAO inhibitors, appetite suppressants, drugs for attention deficit disorder, certain herbal products, cold medications, street drugs, stimulants, and supplements. The risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin, such as certain street drugs, St. John's wort, certain antidepressants, certain opioid medications, and others. Tell your doctor or pharmacist if you are using any of these medications before, during, or within 2 weeks after treatment with Selegiline. To prevent a serious high blood pressure reaction, follow a special diet recommended by your doctor or dietitian to limit your intake of tyramine while taking this medicine. Avoid foods and beverages that are high in tyramine, and limit or avoid foods that are moderate in tyramine. Get medical help right away if you notice symptoms of very high blood pressure such as an unusually fast/slow heartbeat, vomiting, unexplained sweating, headache, chest pain, sudden vision changes, weakness on one side of the body, or trouble speaking. Selegiline may interfere with certain medical or lab tests, so make sure lab personnel and all your doctors know you use this drug. Always check the labels on all your medicines and ask your pharmacist about the safe use of those products. It's important to discuss with your doctor the best timing for taking this medication. If someone has taken too much Selegiline HCl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may not appear for up to 12 hours and can include excitement, irritability, restlessness, weakness, drowsiness, flushing, sweating, fast heartbeat, headache, confusion, and seizures. This medication should only be used by the person it was prescribed for. Do not share it with others. If you happen to forget a dose of Selegiline HCl, simply take it as soon as you realize. However, if it's close to the time for your next dose, it's best to just skip the missed one. Make sure to take the next dose at your regular scheduled time. Do not take 2 doses at once to make up for the missed one. Be sure to store Selegiline HCl at room temperature, away from light and moisture. It's important to keep all medications out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when the medication is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.